Hello, everyone. My name is Ashley, and this is my presentation on substance use, abuse, and misuse for NU 673 Psychiatric Mental Health Care 1. The country of America faces a number of alarming mental health statistics post-pandemic, with the abuse and misuse of alcohol being one of them. Alcohol is considered one of society's oldest and most commonly used mind-altering substances with deep-rooted ties in mainstream culture. Alcohol is heavily marketed and has become associated with celebrating and relaxing. Many Americans will not develop a problem, but many will. Alcohol use is widespread, however, which can cause many to ignore the warning signs. Although the opioid crisis continues to dominate the news headlines, alcohol is deserving of just as much consideration and attention. The aim of this presentation will be to investigate the history of alcohol and alcoholism, its prevalence and epidemiology within the United States, risk factors and vulnerabilities, effects of alcohol, signs and symptoms of abuse and potential for overdose or suicidality, and an example of a care plan for a patient suffering from alcoholism will also be presented. Although the problem is often overlooked, America's alcohol use is not healthy. Alcohol abuse dates all the way back to the 1770s and colonialism, with the average American at that time indulging in approximately 3.5 gallons of alcohol per year. This is double the current national average. It became routine to consume alcohol with every meal during that time. Furthermore, it became common for people to begin their day with an eye opener and end it with a nightcap. To overcome the steep prices of imported beer, colonists learned how to ferment their own liquor with peach juice and apple cider. Rum, however, was imported from the West Indies still. It was accepted for people of all ages to indulge in alcoholic drinks, including toddlers who would drink the more sugary drinks. The Europeans that traveled to America in the 1600s were also considered heavy drinkers. However, following the American Revolution, the British refused to supply the colonists with alcohol. By that time, Kentucky and Ohio already had their surplus of corn, which was used to produce whiskey. Since whiskey ended up being cheaper than beer, coffee, and milk, and the water supply was contaminated in many areas, many turned to whiskey for their drinks. By the 1830s, the national average for alcohol intake of citizens over the age of 15 was 7 gallons of alcohol per year. Due to the widespread use of alcohol, many New England ministers decried public intoxication as sin, but they were not imposed entirely, while Protestant ministers demanded abstinence. Massachusetts became the first state to ban the sale of alcohol in 1838, and by 1850, half of the American population had stopped drinking entirely. During World War I, nationwide prohibition spread due to activists that claimed the grain should be used for the war and not alcohol. In addition, German-based breweries were boycotted due to the anti-German sentiment that developed from the war. Congress soon passed the 18th Amendment, declaring the sale and distribution of alcohol illegal. Prohibition did end in 1933, but many states continued to keep alcohol illegal. During America's prosperous years following the Second World War in 1945, however, drinking became more widespread and once again became an important part of American culture during the decades that followed. This has brought us to modern day, where concerns of fetal alcohol syndrome, teens driving drunk, and drunk driving remain despite alcohol continuing to be mainstream. Now I would like to read off some statistics I feel would give a better picture on just how serious America's drinking problem is. 85.6% of individuals 18 years of age and older reported they had a drink at some point in their lifetime. 69.5% of Americans reported they had a drink in the past year. 25.8% of individuals 18 years of age and older reported binge drinking within the past month. 14.5 million people ages 12 and older suffer from alcohol use disorder. Of this number, 414,000 adolescents ages 12 to 17 suffer from alcohol use disorder. Of those who suffer from alcohol use disorder, only 7.2% of adults receive treatment, while only 6.4% of adolescents receive treatment. Of those suffering from alcohol use disorder, less than 4% of people were prescribed medication to treat the disorder. 95,000 people die from alcohol-related causes annually, which accounts for the third leading preventable cause of death. The first is tobacco, and the second is poor diet and lack of exercise. Alcohol accounts for approximately 18.5% of ED visits and 22.1% of overdose deaths related to prescription opioids. Thus, it is clear that America has a drinking problem that needs to be addressed in order to prevent morbidity and promote patient outcomes. Different elements influence one's risk factor for alcohol abuse. For one, age. It is believed that approximately 9% of those aged 12 to 17 drank alcohol, with 5% of them binge drinking within the last month. Alcohol accelerates the volume decline in the brain's frontal cortical gray matter, which increases the volume of white matter and can severely disrupt brain development. In addition, alcohol use during adolescence puts the person at a higher risk of developing alcohol use disorder later in life. Young adults, ages 18 through late 20s, are also at risk for developing a drinking problem due to the social acceptability and increased opportunities for drinking during this time. There is also a genetic vulnerability that predisposes some to alcoholism. It is believed that 50 to 60% of vulnerability to alcohol use disorder is inherited. For instance, if a person inherits alcohol tolerance, they are more likely to drink more, which subjects them to an increased likelihood of developing alcohol use disorder. In addition, those who experience the stimulating effects of alcohol compared to those who experience the sedating effects are also more likely to develop alcohol use disorder. Furthermore, it is believed that some inherit the genes associated with addiction-related transmitter systems and thus are predisposed to developing alcoholism. Another risk factor is those that experience high levels of stress or trauma. Those that suffer from anxiety disorders, major depressive disorder, post-traumatic stress disorder, and sleep disorders are all at an increased risk of developing alcohol, all at increased risk of abusing alcohol. There are many consequences, both short-term and long-term, that can occur as a result of drinking alcohol. Some of the short-term consequences include injuring oneself or someone else. This includes motor vehicle accidents, falls, drownings, and burns. Violence can ensue due to one's cognitive impairment. This includes homicide, suicide, sexual assault, and intimate partner violence. Another short-term effect is the possibility of alcohol poisoning, which requires medical intervention due to the body's high blood alcohol content. The person may engage in risky behaviors also due to brain impairment, which can include unprotected sex and sex from multiple partners. Mothers who drink while pregnant put their unborn child at risk for miscarriage, possible stillborn, or fetal alcohol syndrome. Long-term health risks associated with long-term use of alcohol poses a number of chronic health risks. This includes hypertension, cardiac disease, stroke, liver disease, and gastrointestinal problems. There is an elevated risk of breast, mouth, throat, liver, colon, and rectum cancer associated with excessive drinking. Learning and memory problems such as dementia and mental health problems such as anxiety and depression are also long-term side effects. In addition, social issues, family issues, and employment issues can all be caused from alcohol use disorder. There are many signs to be on the lookout for and to assess for in those suspected of alcohol use disorder. Some signs and symptoms of current alcohol intoxication include impaired judgment, slurred speech, unstable mood, inattention, memory problems, and poor coordination. Some signs of chronic alcohol abuse include if the person is unable to limit the amount of alcohol they drink or wanting to cut back but being unable to do so. If the person feels they spend a lot of time drinking or recovering from alcohol, this is another red flag for alcohol use disorder. If the person is unable to limit their craving or urge to drink alcohol, or if they have developed a tolerance to alcohol, they may be suffering from alcohol use disorder. Other signs include failing to be able to meet major obligations in their personal life due to their ongoing use of alcohol, passing up on hobbies and activities to use alcohol, and using alcohol in unsafe situations such as driving and swimming. Clinicians should also be on the lookout for withdrawal symptoms such as nausea, tremors, sweating, agitation, headache, and hallucinations. Substance abuse as a whole puts individuals at an increased risk for fatal and non-fatal overdoses, suicide attempts, and death by suicide. Those who abuse substances, including alcohol, are 10 to 14 times more likely to experience death by suicide. In addition, 22% of all deaths by suicide involved alcohol intoxication. And those who start drinking at an early age, those who binge drink or drink heavily, and or those who are involved in drinking behaviors that meet the definition of alcohol use disorder, are all at an increased risk of suicidal thoughts and behaviors. In comparison to those who drink socially, those who drink heavily are 5 times more likely to commit suicide. Furthermore, those who partake in excessive drinking are at risk of alcohol poisoning, overdose, and death. Alcohol poisoning occurs when the person drinks such large quantities of alcohol within a short period of time that causes the body to fail. When this occurs, areas within the brain that control breathing, cardiac function, and temperature shut down, and death occurs. There are currently 3 medications to treat alcohol use disorder that are approved by the Food and Drug Administration. The 3 first-line medications approved include disulfiram, naltrexone, and acamprosate. Although there are medications proven to be effective against alcohol use disorder, only 9% of individuals suffering from alcohol use disorder utilize these pharmacotherapies for treatment. Some off-label second-line medications for those who cannot tolerate the first-line drugs include gabapentin, topiramate, Zofran, and baclofen. And those that experience alcohol withdrawal syndrome due to alcohol use disorder may need medical assistance to withdraw safely. In some who experience alcohol withdrawal syndrome, they may face delirium tremens, seizures, and Wernicke's encephalopathy. In order to prevent and treat alcohol withdrawal syndrome, benzodiazepines are proven to be the most effective and are considered the gold standard. In addition to pharmacological interventions to treat alcohol use disorder, there are also non-pharmacological interventions. These can range from intensive inpatient treatment to less intense, more mainstream outpatient therapy and counseling. The goal in either remains abstinence or reduction of alcohol use through the use of clinician encouragement and education. One form of therapy that is particularly effective against alcohol use disorder includes motivational interviewing. With this form of therapy, the counselor educates patients on the risks they are taking, empowers the patient to change, brainstorms options on how to change, and helps to identify goals for the patient. Cognitive behavior therapy is another form of therapy effective against alcohol use disorder, and in this form of talk therapy, the clinicians create an awareness of the relationship between cognition, emotions, and behavior in order to correct the person's self-destructive thoughts, emotions, and behaviors. There are also group therapy options such as Alcohol Anonymous and/or 12-step facilitation. If the person's alcohol use disorder is more severe, inpatient may be required. Health, diet, and exercise is also known to combat alcohol use disorder. Patients should be educated about the risks and dangers of alcohol use disorder and possible alcohol withdrawal syndrome. They should be educated on ways to cut back and refrain from drinking, such as drinking non-alcoholic beverages at social functions if they are unable to limit their drinking, or rather spend their time doing activities they enjoy that do not involve drinking. The patient should be educated on other ways to manage their stress, such as exercise or meditation. The patient may need a large amount of support and should be encouraged to seek support from friends and family. In addition, the patient should be educated to maintain compliance with any therapy sessions and/or medication regimens they were prescribed. If patients with alcohol use disorder require more intensive therapy, then the clinician can provide, given the setting they are in, then referral should be made to the appropriate support groups. Again, these support groups may be inpatient or outpatient and should be tailored to meet the needs of the patient. Any kind of follow-up for patients suffering from alcohol use disorder should involve monitoring for relapse or risk of relapse, reviewing their current treatment regimen, providing additional counseling and education, and checking for any drug interactions and/or contraindications. The risks and dangers of misuse and abuse of alcohol are clear. Alcohol not only affects the individual patient, but can affect families and their communities. Furthermore, in a post-pandemic country filled with economic uncertainty and political unrest, the country's rates of alcohol use disorder are unclear and at risk to increase. As clinicians, patients need to be properly screened and educated in order to properly diagnose and treat any patients at risk or any patients currently suffering from alcohol use disorder. It will be interesting to see how the country copes with the current situation, and hopefully rates will decrease rather than rise. Thank you.